COVID-19 has sunk its teeth deep. India saw the number of cases rise dramatically when almost 800 new cases tested positive. India's COVID-19 trajectory has been steep over the past few days. Yet India's case curve still remains flatter than that of countries like the USA at the same stage. But over the last few days, hotspots have emerged across India, with Maharashtra leading the states, followed by Tamil Nadu and Delhi. The entire country has already been under lockdown for 14 of the 21-day period announced by Prime Minister Modi. And urban centres like Mumbai and Delhi have emerged as epicentres of the infection, with the numbers mounting relentlessly on a daily basis.
Hello and welcome to Info Corona, where we bring you information, cut the noise, the sensation, and focus on the news. Today we are going to focus on Info Corona, on the hotspots of our big cities, and then contrast them with the smaller states of the country. Is there a difference today, a stark difference between the densely populated regions of India and those which perhaps are much smaller in size? Now, COVID-19 cases in India have risen by 34% over the past 2 days, bringing the total number of cases in the country to into the 5,000 plus zone. And the city of dreams, Mumbai, is the one that has now become the main urban hotspot, reeling under the onslaught of coronavirus. With over 680 cases in the city, Mumbai now is Maharashtra and the country's COVID-19 hotspot. Our top focus, therefore, is on Mumbai.
Mumbai, the country's financial capital, has emerged as one of the biggest hotspots of the COVID-19 infection. And looking at the mounting number of cases, the state government passed an order making the wearing of masks compulsory in the entire city. Urgent and additional measures were needed because by Tuesday, the city had breached the 500 infected cases mark. And with the rate of cases testing positive mounting each day, Mumbai's COVID-19 graph seems to be on a one-way climb.
The total number of COVID positive cases has now reached 1,018 in Maharashtra, of which 642 are from Mumbai. Within the last 24 hours, there was a rise of 150 cases, of which 116 cases were from Mumbai. Over 40 deaths have been recorded in Mumbai itself.
Mumbai authorities have identified administrative wards in the city with the highest number of positive cases. The D ward, which covers areas like Pedder Road, reported 43 cases as of April 6th. Now, data released by health officials reveal that one of Mumbai's poshest area in Ward D, Malabar Hills, is the new hotspot after Worli Kolivara. Apart from a multitude of film stars, India's richest man, Mukesh Ambani, also resides in this area. Mumbai's E ward, consisting of areas like Baikala and Mumbai Central, has also emerged as hotbed of COVID-19 patients. Till Tuesday, the E ward had reported 83 positive cases. The Wockhardt Hospital, where 52 health workers tested positive, also comes under E ward. Meanwhile, the scare over Dharavi continues as 2 fresh cases having been reported from this area, considered as the largest slum cluster in Asia. This addition takes the total number of cases in Dharavi to 9. The Chief Minister Uddhav Thakere's home, Matushri, in the heart of Mumbai's Bandra East, has also been designated as a corona hotspot. The bungalow and nearby buildings have been sealed off and named a containment zone after a tea seller in the area tested positive for coronavirus. As Mumbai's famed Siddhivinayak temple continued to sport its unnatural empty look, the Chief Minister of Maharashtra gave his update on the situation in Mumbai.
आपल्या यंत्रणेतील जसे आपले आरोग्य सेवा आहे, पोलीस आहेत, इतर सर्व कर्मचारी आहेत, हे तर अहोरात्र मेहनत करतायत. पण एका गोष्टीचा उल्लेख माझ्याकडून आजपर्यंत राहिला होता, ते म्हणजे आपले सगळे विभागीय आयुक्त, जिल्हाधिकारी, त्याच्यानंतर जिल्हा परिषद आहे, महानगरपालिका आहे, नगरपालिका आहे, सगळेच महसूल खात्याचे सगळे कर्मचारी आहेत. जे कोणी ह्या युद्धात आपल्यासोबत आपल्यासाठी युद्धभूमीवरती उतरून अहोरात्र मेहनत करतायत, त्यांना मी धन्यवाद देतोय.
So, Uddhav Thackeray recognizes that Mumbai now is at the heart of the COVID spread. Well, our correspondent Tanushree Pandey is in the Malabar Hill area. Remember, this is an upscale area with the highest per capita income in the country. Let's hear what she has to say in an area where there have been a number of COVID-19 cases.
We are right now in Malabar Hills, which falls under Ward D. And one of the reasons why this area has been reporting growing cases of COVID-19 is that most of the families, people living in this area, come from affluent background, come from opulent background, and many of them had an international travel history. Many of the families here traveled abroad, and due to that, they contracted the infection. And we also had cases of watchmen, maids, servants contracting the infection from their owners of the affluent families here. So that remains to be one of the reasons why Ward D in Mumbai, where Malabar Hills, Arthur Road and many such areas come, have been reporting growing number of COVID-19 cases. Now something you will see here as compared to other parts of Mumbai is that not even local shops or grocery shops are open in this particular area. So what this particular area has done is that every apartment, since most of the families are affluent families, so every apartment has their own local shop inside their own apartment. So a person doesn't really have to come out on the street, and the authorities are making sure of that. With video journalist Prashant in Mumbai and Tanushree Pandey for India Today.
That is Mumbai. The other city which has emerged clearly as a hotspot is Delhi. This is a city which has found that its number of corona cases have doubled every 4 days in the past week. 51 new coronavirus cases reported in Delhi just today, taking the total to 576. Take a look at the situation in the national capital.
The streets of Delhi wear a deserted look. And yet, the number of COVID positive cases continues to mount in the capital of India. Delhi so far has 576 confirmed cases of the novel coronavirus, and 9 people have lost their lives. And on everybody's mind is the question of what after April 14th, when the national lockdown is supposed to come to an end.
लॉकडाउन की वजह से जो हमने एक्सपेक्ट किए थे पहले केसेस उससे कम आ रहे हैं, और जो इसका ग्राफ बनाए गए थे कि भी रेट ऑफ ग्रोथ जो रहेगी उससे कम है, परंतु इसके बारे में जो डिसीजन है, फाइनल डिसीजन सेंट्रल गवर्नमेंट ही करेगी.
Delhi currently has 3 coronavirus containment zones, one at Dilshad Garden in northeast Delhi and the other 2 are in South Delhi, Nizamuddin Basti and South Moti Bagh. Dilshad Garden and Nizamuddin were earlier the 2 coronavirus hotspot zones of Delhi before being declared as containment zones. They are completely sealed with no outdoor or indoor movements allowed. The Delhi State Cancer Institute in Dilshad Garden has been temporarily shut after 18 healthcare staff members were confirmed positive for coronavirus. Nizamuddin became a containment zone after the Tablighi Jamaat congregation added to the rising Delhi numbers. On Wednesday, Chief Minister Arvind Kejriwal held a video conference with members of parliament from Delhi, and they spoke about the prevailing situation. A day earlier, on Tuesday, the Chief Minister of Delhi had announced the 5T action plan to tackle the situation. The major focus was on testing.
अभी तक टेस्टिंग किट्स की बड़ी समस्या थी. अब थोड़ी सी समस्या सुधरी है। हमने ऑलरेडी 50,000 लोगों के टेस्ट के लिए ऑर्डर किया हुआ है और वो ऑर्डर आने चालू हो गए हैं। 1 लाख लोगों के रैपिड टेस्ट के लिए हम लोगों ने ऑर्डर कर दिया है और शुक्रवार से हमें वो 1 लाख रैपिड टेस्ट कराने के लिए हमारे पास डिलीवरी चालू हो जाएगी। रैपिड टेस्ट आने के बाद जो जो हमारे हॉटस्पॉट्स हैं, जहां हमें लगता है कि कोरोना के पेशेंट थोड़े से ज़्यादा निकले, जैसे मरकज़ में निकले, मरकज़ के आसपास का जो निज़ामुद्दीन का एरिया है, उस तरह से दिल्ली में दिलशाद गार्डन में थोड़े से ज़्यादा निकले थे। तो उस तरह से जितने हमारे ऐसे एरियाज़ हैं, उन एरियाज़ के अंदर हम ज़्यादा रैपिड टेस्ट को ज़्यादा इस्तेमाल करके वहाँ पे रैंडम टेस्ट कराएंगे, ताकि हमें पता चल सके कि कोरोना कहीं वहाँ ज़्यादा फैल तो नहीं रहा और हमें पता ही ना चले। तो रैपिड टेस्ट को इस्तेमाल किया जाएगा और जो डिटेल्ड टेस्ट होते हैं उनको भी इस्तेमाल किया जाएगा।
Delhi is the first state to begin random testing and is expected to conduct more than 1,000 tests per day.
So Mumbai and Delhi, the two big cities which find themselves as coronavirus hotspots. Kamlesh Sutar is joining me from Mumbai, Ankit Tyagi joining me from Delhi. I'm told, Kamlesh, today the Mumbai Municipal Corporation has decided to step up the fight. They've even advised every individual now has to wear a mask. Have they made it mandatory to wear masks? Is that one part of their strategy? What exactly are the authorities in Mumbai planning to check the proliferation of coronavirus cases there?
Well, Rajdeep, yes, initially the state government had made mask mandatory only at government offices for government officials and all the visitors. And now today, through an order, the BMC has made it mandatory, and even the state government has forwarded it, saying that wearing mask will be mandatory for everyone, and not adhering to it would also invite penal action. So there could be an extreme step like being arrested or being fined for that. But the government and the administration is going to strictly adhere to that. Everybody who moves out, in the first place, you don't have to move out of your house unless and until it is of utmost necessity. But even if you move out for some necessity, you will have to wear a mask, and it doesn't has to be a surgical mask, so as to say. You can even wear a mask made of handkerchief, but everywhere you go out of the house, you have to wear the mask. So that is one of the most important steps that has been taken by the state government and the BMC here as well. And before Rajdeep, let me also give a quick update that has just come in from the state government. So now Maharashtra's number stands at 1,135. That is 1,135 cases, 117 new cases in Maharashtra today, with maximum number of cases again coming in from Mumbai, 72 cases from Mumbai and 36 coming in from Pune. And Dharavi again remains an area of concern, the number now slowly growing. So the number of COVID positive patients in Dharavi has now reached 13. So the administration is obviously pulling up its socks. Today Uddhav Thackeray, while addressing, also made an appeal to all retired doctors and medical practitioners to come out and help and register themselves if they are willing to offer their services. The state government is leaving no stone unturned as far as its fight against coronavirus is concerned.
So in Mumbai at the moment, it's clear that this is now a critical week that we're entering. And the same situation in Delhi. Ankit Tyagi with us. Ankit, the next 1 week, we're told that by Thursday or by Friday certainly, you'll have these 1 lakh test kits available to do random testing. Is that what the Delhi government sees as its big pitch to take on corona in the city?
That's right, Rajdeep. Thursday, they are expecting delivery of 1 lakh testing kits, rapid testing kits. On Friday, they will be rolled out. The first phase of testing will only be done in the hotspot of Nizamuddin West and also the Nandnagri area. Apart from that, all the health workers, doctors, and those who are closely involved as far as the treatment of coronavirus is concerned, those who are in contact with the coronavirus patients, they will also be undergoing the entire rapid testing process. Now, the government is hoping that they are going to ramp up testing. They already have ramped up their efforts as far as number of hospital beds, isolation centers in Delhi is concerned. The government is already in talks with private hospitals. If the number of cases increase further, they are going to in fact take over the private hospitals, and the hotels are also in talks with the government to be turned into complete isolation camps.
So basically they're looking at the next few days as critical to try and in some way flatten the curve. Am I correct?
That's right. If the government believes that if in the next 1 week or so they are not able to flatten the curve, not able to get the number of cases down, largely these cases have come from the Merkers, incident. Like one freak incident has been reported from Defence Colony, where a family has been infected, 3 people infected by, the allegation is possibly by one of their driver who is now missing. These are the kind of cases which are worrying Arvind Kejriwal and the government. They would want all of them to be under control. Remember, there are still about 600 members from the Merkers, those whose tests are pending. So the numbers in the next few days can shoot up in Delhi if all of them turn, or large number of them turn positive.
Okay, Ankit Tyagi, Kamlesh Sutar telling us what's happening in India's 2 big cities that are under the shadow of the coronavirus. Thanks very much for joining us. Let's take a break. When we return on the other side, let's now turn from the big cities of Mumbai and Delhi to one of the smallest states in the country, Goa. Tourist haven, but a state which at least for now has been remarkably isolated from the coronavirus pandemic. The total number of cases here, 7, no deaths reported, and the state slowly seems to be coming to terms with the epidemic. To deal with the crisis, a network of volunteers and helplines have been set up after the initial chaos in the state. Let's take a look at today's report from tiny Goa.
हिंदू, मुस्लिम, क्रिश्चियन सभी धर्मगुरु ने खुद का वीडियो निकाल के वो वीडियो पे मैसेज देना चाहिए कि इकट्ठा मत आ जाना, इकट्ठा आके कौन सी भी प्रार्थना सभा न करना, सभी सोशल डिस्टेंसिंग मेंटेन करें और कोविड-19 के फाइट में गोवा गवर्नमेंट का सहकार्य करें। कुछ लोग गवर्नमेंट क्या सुनता नहीं है, मुझे लगता है कम से कम धर्मगुरु की सुने।
That was the Chief Minister of Goa. He has assured the people of the state that there is adequate supply of all essential goods. He said that a network of volunteers had been put in place and there were helpline numbers to take care of the needs of the people. A couple of days ago, this is what the streets of Goa looked like. In wholesale markets as well as banks, no social distancing was being followed and people were struggling for the basics.
Most of the grocery stores are closed. We are facing much problem for the daily needs such as rice, atta and all.
In the main market of Mapusa, 13 kilometers from Panaji, most shops down shutters after the announcement of the lockdown.
सब सांताक्रूज में दुकान में बहुत लूट मार चालू है और ये पणजी में ये दुकान में इधर तो 800 रुपए है उधर 850 में ऐसा कैसे है रेट.
The Fisheries Department allowed sale of fish in the state from the 6th of April with certain riders, which included strict implementation of social distancing. The sale of fish, the key kitchen staple of people in the coastal state, was banned since the enforcement of lockdown last month.
Initially we had, but now we have no problem.
The number of infected in Goa is still very low, but the lockdown had created big problems for this small state. The shortage of essentials and the confusion in the initial days saw desperate Goans lining up for food that was not available. But now the situation has more or less stabilized.
Now, as the country goes through the 15th day of the national lockdown and state after state grapple with an increasing number of a caseload, it's the smaller states and the union territories that seem to be doing better during the pandemic. Take a look at just how small India is coping up with this large problem.
According to the data released by Ministry of Health and Family Welfare, there are some northeastern states which till now have not seen a single COVID-19 positive case. But with 27 positives, Assam has the highest number of cases in the region. Manipur too recorded 2 cases. Arunachal Pradesh, Tripura and Mizoram has 1 case of COVID-19 each. And Nagaland, Meghalaya and Sikkim remain COVID-free till now. In Assam, much like other states across the country, despite assurances from the government to keep up the continued supply of essential commodities, tales of shortages have emerged.
আমার সরঞ্জাম নাই আমার যেহেতু কিট দিয়া নাই মা টুপি এটা বিচাৰিব বলে নাই গ্লোভস এটা বিচাৰিব লগে নাই মাস্ক এটা বিচাৰিব লগে নাই কই তুমি কিনিছা নহয় হেতু ইউজ কৰি থাকা.
Assam's health department, however, says they are ready to tackle the pandemic. Data released by the department to India Today shows there are total 7,215 quarantine beds, 435 ICU beds, 206 ventilators available in government-run hospitals across the state. In Sikkim, the lockdown is strictly in place. India Today's ground report shows this small state has its house in order. Locals claim supply chain are intact and there are no shortages of essential commodities yet.
एक महत्वपूर्ण सूचना सुनिए। आजकल विश्व भर में कोरोना वायरस बहुत तेजी से फैल रहा है।
In northern India, the newly carved Union Territory of Ladakh has recorded a total of 14 cases of coronavirus till now, 11 in Leh and 3 in Kargil. The good news is that 10 of them have already been discharged. In the plains, Jharkhand, another small state, till now has maintained the lockdown well and ensured smooth supply of essential commodities. So far, the count of coronavirus patients in the state is 4. All reports point to the government having ensured the poor, the stranded and the daily wagers have all been catered to. While the small states of India seem to have been able to handle the situation comparatively better, it should still be taken with caution since the impact till now has been negligible.
That's all we have time for in this edition of Info Corona. On the other side, Rahul Kaval will bring you all the very latest on News Track. Keep watching India Today.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.